Alright, so let's now talk about the clinical presentation, diagnosis and possible treatments. Look, there are, once again, we should look at the emphysema in two ways. One is a pure emphysema, that is this type, pan-lobular, because of genetic deficiency of alpha-1 antitrypsin. Lesser common than the emphysema caused by the smoking. But let's say that is a pure emphysema. Normally the patient would come in, patient would have hunched over back, he will be dyspnea, he will have dyspnea, so he will be aware of the difficulty of breathing and he'll be trying to squeeze the air out. So the problem appears at the expiration, exhalation. So patient would have long expirations like this. So you'll see that the patient is having problem. Normally these patients have loss of weight, so much so that you might think that they have a hidden tumor somewhere. They do not develop congestive heart failure. Normally cough and wheezing is not present unless the chronic bronchitis is added to it. So that is the barrel-shaped chest, tall, lanky person, weak, and then on the X-ray you would see long, big lungs, hyperinflated lungs. So that is the problem with the pure emphysema, pan-lobular. These patients are also called pink puffers. The reason for that is that in the pan-lobular emphysema, lungs are big, but patient is dyspneic, so he's struggling, and part of that struggle is that he does extra ventilation, and that extra ventilation kind of compensates for oxygenation, so hypoxia does not occur. However, they are doing right, so they are called pink puffers. They don't have hypoxia, but they are puffing, they are huffing and puffing. On the other hand, now if you look at the ones who have COPD, that means they have emphysema plus chronic bronchitis, their situation is slightly different. Somehow they do not develop dyspnea, so they are not very much aware that they are having a problem. The result is they do not struggle to breathe, and the result of that is that they have reduced gas exchange because of the emphysema, and the result of that is they are cyanotic because there is hypoxia plus there is hypercapnia, there is more carbon dioxide, so they are cyanotic. In addition to that, somehow they are obese. It's not known why. They are called blue bloaters. Normally they have core pulmonale developed, they have pulmonary hypertension developed. Why is the pulmonary hypertension? Two reasons. Number one, the destruction of the alveoli reduces, it also destroys the capillaries that are present here, so that reduces the surface area of the capillaries, and so pushing the blood into the lungs becomes difficult. And secondly, because of the hyperinflation and the hypoxia that occurs in these areas of hyperinflation where oxygen is actually not moving in and out, that hypoxia would cause local vasospasm, that would cause pulmonary hypertension, that would cause cor pulmonale. All of these patients normally have FEV1 to FVC ratio lesser than 70%. That is one of the diagnostic criteria. And how do you treat them? There are many ways to treat depending upon what is the current situation of the patient. For example, there could be the oxygen that is given, there could be some part of the lung removed to help this, steroids are given to reduce inflammation. Of course, you ask a patient to reduce smoking right away. There can be phosphodiesterase inhibitors that are given. So anti-inflammatory drugs are given, surgical procedures are done. Basic approach to the treatment is to reduce the progress and help the patient maintain a healthy life and functional life. So that is basically the treatment that is done. So one more thing with the clinical is the cause of death in these patients is usually respiratory acidosis because of the carbon dioxide that is accumulating inside, and that causes hydrogen ions to be produced. So respiratory acidosis is one, and then of course because of the pulmonary hypertension, right heart failure. So these are the reasons that patient dies off. Thank you. Guys, thank you very much for watching. Make sure that you like, subscribe, and share this video. Like it if you like it. If you don't like it, then don't like it. And then subscribe if you want more videos. We upload videos regularly. So if you subscribe to the channel, you can get a notification and the video will appear in your inbox. And if you hit the bell button as well, then you can get the notifications for this as well.